You're watching The Migraine Solution by Dr. Lisa Gall on Resonance Wellness TV, part of our Whole Life Medicine Alleviate series. Keep in the loop about future webinars and events on whole-life-medicine.com. So hello and welcome to The Migraine Solution. My name is Dr. Lisa Gall and I will be your guide this evening about this exploration of the wide spectrum of the reasons for the production of migraines. And as per usual, this presentation is given in the context of the whole life medicine model, which is the model that I use at Resonance Wellness when I'm evaluating your healthcare situation. So migraines are a very good example of the requirement to do a thorough root cause review. And today we're going to look at the multiple contributing causes to migraines, including issues with toxicity, and the need to detoxify, and the potential missing ingredients. We'll also talk through some major treatment types that I've found useful in practice. And we're obviously also going to be talking about some problem-specific solutions for migraine. Once again, you're going to see some pretty common factors crop up today, things that we've already discussed in the context of a lot of health issues, such as diet and hormones, toxins, stress. Actually, I think retrospectively, I think we can probably say that most of the things we've spoken about could be involved in the propensity to migraine. So we're going to take a little look at the history of migraine first. So migraines have been described for thousands of years. And as you can see from some of these pictures, on the left-hand side here, there's a picture of an Egyptian treatment for migraine. So the ancient Egyptians treated headaches with a cooling strategy. And what it involved was strapping a clay crocodile pot filled with cool water and herbs, and then sticking you in a dark room. And I have no idea why it's a crocodile, to be honest. I tried figuring it out, but apparently that's a pot that they have strapped on the head there. I don't know if the Egyptians just made a lot of clay crocodiles or there was some symbolism to it. I couldn't figure it out. I don't recommend strapping an actual crocodile to your head, and I don't think they did either. The Egyptians actually left behind a number of medical papyri, and the Ebers papyrus is the one that described headaches so severe that even the god Horus was forced to live in a cave in the dark. The ancient Sumerians wrote about head pain brought by the goddess of wind, and of course in Calgary we have that wind called a Chinook. Hippocrates wrote about migraines and their various triggers also, and he noted that people on the lee side of a mountain range away from an ocean often suffered from migraine, which of course is exactly where we are. Various bleeding techniques have been used over the millennia, probably because of the association of the headache with the heartbeat. The four humors theory blamed migraines on excess bile and often induced vomiting to help, which actually does sometimes help. The Eastern traditional Chinese medicine model attributes headache to the gallbladder meridian, and this correlates pretty well with the muscles and points under that meridian, many of which are in classic locations for migraine. We'll see that in a moment. And migraine auras, I have this picture here of the Alice in Wonderland illustration, because it's thought that migraine auras might have inspired the vanishing Cheshire cat in the Alice in Wonderland book, and also the bizarre changes in body size and shape found in the story. Some people with migraines have the experience of parts of their body seeming strangely proportioned. Drilling holes in the head is a procedure called trepanation, and that was often attempted in migraine for various reasons over many millennia, from the Stone Age to the relatively recent past. And on this right-hand side here is an illustration by an Italian physician at the turn of the 14th century that's illustrating that. So clearly migraine is not a new problem, and I'm sure the odd migraine sufferer has really wanted to put a hole in their skull every once in a while. So I thought I would show you what the supposed distribution of migraine is around the world. So this is the prevalence per 100,000 population. And here you can see that in Canada, approximately 15 to 16% of people are reporting migraine. Something to note here is that places on this map that show low incidence may actually be underreported. For example, China is showing up here on the low end, even though on other studies, it actually shows an incidence substantially higher, especially in the most populated areas of the east coast of China. So it would be closer to a red-colored country if we went on some of the study data. Basically, there's a lot of difficulty in truly ascertaining what the incidence is of migraine, and that's probably for many reasons. And this kind of led me to my next slide. This has two kind of components to it. So migraine type and prevalence. And on the left-hand side here, we have a graphic from a survey of neurologists. So that's people who study the nervous system, they're nervous system specialists, who have had personal history of migraine, and their migraine types from their own experience are listed here. Ostensibly that's a group of people who should be able to diagnose themselves. And here you can see that most migraine sufferers, at least in the neurology set, have the experience of an aura, and there's also a significant number without. We're going to look at auras in a moment. On the right, you can see age and sex differences in incidence of migraines and tension headaches. So the top curve is migraines and the bottom curve is tension. The blue is representing females and the red is representing males. So there's an obvious increased incidence in females. And the peak age for both sexes is around 30 to 35 years old in both types of headaches. It's basically thought, based on this data, and many other collections like it, that tension headache and migraine might be on a continuum to some extent, although there's obvious differences in some of the subtypes between tension headache and migraines, as we're going to see here today. So migraines can be divided generally into two subtypes: a migraine with an aura and a migraine without an aura. So if you're looking at migraine headaches without an aura, it's really more than just a headache. The diagnosis of this kind of migraine is made when there's been at least 5 attacks of pain, usually on one side of the head. It's a pain that has a pulsating quality. Remember, we were talking about the heartbeat quality to it before. The pain is severe and it lasts between 4 to 72 hours. It's aggravated by physical activity. It's associated with either nausea or vomiting or light sensitivity or both. So it's totally possible, however, that this kind of migraine is not one-sided. And it's also possible, especially in children, that the pain is not experienced in the head at all, but in the abdomen. This is known as an abdominal migraine. And that can occur in adults as well, but it's more rare in that age group. A migraine can be preceded by what's known as a prodrome. So that's a group of symptoms that appear on the run-up to the actual headache. And that can include things like feeling hyper or irritable, yawning, fatigue, craving foods, and dark circles under the eyes. Now, a migraine with an aura is a migraine that strikes after or alongside a sensory disturbance. That's called an aura. Auras can be visual. So the visual symptoms you could have could be blind spots, otherwise known as photomas, which are sometimes outlined by these simple geometric designs. You can just have those kind of geometric designs on their own, gradually floating across your field of vision. You can have shivering spots or stars, changes in vision, or up to complete vision loss. I've seen up to complete vision loss in people. You can also have flashes of light. Part of the aura may also be sensory aspects, like you might feel like there's numbness or tingling in a hand or tingling in the face. They can be speech or language related, where the person can't speak or it comes out all garbled. There can be motor symptoms, mainly muscle weaknesses, but it can go so far that a person can't move a part of their body, or that part of the body is just really weak. You can also have symptoms coming from the brainstem, where you have tinnitus or vertigo, or you can have retinal migraines, where only one eye is affected, and it's related directly to the vessels going to that one eye. Actually, there's not usually pain with this type, but it still will freak you out if you go suddenly blind in an eye. And aura symptoms can obviously cause a lot of alarm, because it obviously closely can resemble a stroke. especially if the pain is not very marked, and especially at the very beginning of the migraine. And it's not uncommon for people to end up in the ER with those kinds of symptoms. Often a stroke will actually be ruled out, especially if that person has never had a migraine like that before. And about 70% of patients will have a first-degree relative with a history of migraine. The risk of migraine is increased about 4-fold in relatives of people who have migraines with auras. And so migraine headache actually shows a multifactorial inheritance pattern. The specific nature of the genetic influence is not yet completely understood. There are a couple of theories that involve changes in the ion channels that are going over the cell membranes. And we'll talk about that a little bit more in a sec. This is an image from the Migraine Art Project. It's very unfortunate because the Migraine Art Project was done for a group that used to advise people about migraine in the United Kingdom. And unfortunately, nobody's maintaining that website anymore. So it's kind of deep in archive, but they had some great images showing some of the classic visual auras that can appear at the onset of a headache. And there's many famous people over the millennia that have probably suffered from headaches and of this type, and they have been variously interpreted. As an example, Hildegard of von Bingen was thought to probably have had migraines because she actually has some of the imagery that she's recorded and some of the experience that she's recorded with and without pain. So it used to be thought of as a little bit more mystical of an event than I think we would consider it now. Now, very likely, migraines are caused by multiple systems coming together to produce the symptoms. It was originally thought that migraines were only vascular in nature, so about the blood vessels. And originally, it was blood vessel dilation or vasodilation that was proposed, and then vasoconstriction was proposed. But it's probably a combination of both. And again, like I was saying, there's probably genetic variations in ion channels. So ion channels are big proteins that form tubes through cell membranes. And what those do is they allow for exchange of charged ions like sodium or potassium. And the thought is that perhaps these things are not working properly. Ion channels are big proteins. They require a lot of cofactors. They often have binding sites and active sites within them, and they're often triggered by molecules on the outside, on receptors, or sometimes on the inside as well. So the strength of the vasodilation, vasoconstriction argument is that drugs that change blood vessel diameter can sometimes help migraines, like ergotamine, which is a compound from rye, ergot fungus on rye, and caffeine. Caffeine has a pretty vasoactive capacity. And for some people, the miracle for their migraines is actually having a good, strong coffee. So nervous system activity has obviously also been proposed, and in particular, it's the trigeminal nerve. So that's the one that has its branches in the face. We're going to see an illustration of that shortly. And connections into pain pathways right in the middle of the brain that are thought to be part of the migraine experience. And there's actually waves of nerve activation over the whole brain that seems to be how the aura is produced as well. There's also quite clearly an inflammatory component present. So some of this is evident in the brain during the migraine, but it's also related likely to body-wide inflammation. So changes in how pain is perceived might also be part of the picture, like we were looking at that Alice in Wonderland diagram, that there might actually be misperceptions about pain. There's also a direct connection between the dura mater of the brain. So the dura mater is the tough outer lining that kind of holds in the cerebral spinal fluid. So there's a little bridge between the dura mater of the brain and the neck musculature that can play a role. I'm going to show you a picture of that in a sec. The newest drugs that have an effect on migraine are the triptans. So a lot of the time when we're looking for what is the potential cause of something sometimes will work backward. In pharmacology, a lot of times it's worked backward. So you find something that works and then you kind of think, okay, if that works, then this must mean this. So triptan drugs bind a class of serotonin receptors, but of course that can't be the full answer either. Other neurotransmitters are clearly involved, but triptans can head off a migraine attack, and probably about half of the people who take them. They don't work for everyone, and they often share unpleasant side effects with like the ergotamine and many pain medications, in that if a person is taking them too frequently, the headaches may actually become more frequent and severe. It's a quite strong rebound effect with those drugs. In newer research, there's a clear contribution to migraine that's caused by the release of a peptide that's called calcitonin gene-related peptide, or CGRP. A peptide is basically a little mini protein, a signaling protein. So in a study of thyroid hormones, where they were studying a thyroid hormone called calcitonin, and basically what that does is it helps to regulate the body's sodium and calcium levels. The researchers found that the same gene that encodes calcitonin in the thyroid gland produces a slightly different peptide in another part of the brain. And so basically it's this peptide. And so they're finding that this peptide, the CGRP peptide, is pretty plentiful in brain pathways that process pain and in brain regions that regulate blood flow. So there was another researcher that wondered, as an example, why, or whether or not that was involved in migraines because of that. And he actually found that CGRP can trigger what is considered a hallmark sign of migraine. So if it's released from the trigeminal vascular nerves. So these are the nerves that are alongside the the vasculature is innervated by nerves, like right over that same area of your face. And it's a super powerful vasodilator of cerebral blood vessels. So there's all these connections, between thyroid, the pancreas, and pain in brain regions. So we're going to see variations on this of the theme as we're looking at different subtypes. And I know this diagram is a little bit maybe scientific overkill here, but it's hard to find simplified diagrams for patient webinars. I hope it isn't too overwhelming, but we're going to kind of come back and take a look at some of these pieces. So my experience is that you can pretty significantly improve your migraine severity and incidence, and usually like relatively permanently. But the catch is that it does take some work. It does take some investigation. And in some cases, there might be strategies you have to have in place over the long term. And I think what it points out is that this is really one of the conditions that shows you how integrated the body systems actually are. So I thought we would look at some kind of beginner places. So if you can always start by asking yourself, if you have migraines, what was going on in life when these migraines began, especially if they had a more sudden onset. It's always a great idea to keep a migraine diary and pain map. They can really provide clues, and we're going to see, again, in various ways as we're moving on here, what kind of clues this can give you. But the questions that are important are like, does the pain appear in the front or the back or the temples or the top of your head? Does it start at the front and move backwards, or start at the back and move forwards? Do you notice it in your teeth? Like, which teeth do you notice it in? Where you actually open your mouth and figure out which teeth it is. Is there numbness or tingling in legs or arms or fingers? Which fingers? Which part of the arm? Do they happen after particular types of emotional or physical stress? Are they kind of cyclical? Like, do they have a daily type of cycle, or a monthly or weekly or yearly cycle? Do you only see them in allergy season? Do you only see them around your period? Does it occur with hunger or having a particular kind of food or drink? Does it happen if you have a lousy sleep? Or does it happen with leg cramps? What do you notice first, and how does it progress? It's what kind of aura do you have? These things are all important little indicators about where some of the beginning places for you are. And here I'm just showing you, this is a brilliant headache migration progression chart that somebody had made And it shows you like where does it first appear and then where is it last. And this was brilliant, because when you can do it like this, you can get really close to why is it coming and where is it coming from and why. Also, I would try to keep records of the pain quantity using a scale. And I'm hoping that your screen is big enough to see at least part of this scale. I kind of tucked it in behind here. You can just ask me for a copy of this scale if you need it. It's a migraine description scale. It's important to know like how intense are they really. You also want to record all of the medications you use. So pain medications, migraine medications, supplements, and when you're using them in timing to other things. If you can combine that with a food diary, that would be awesome most of the time. And also to record your temperature and blood pressure. And if you have monitored for it, your blood sugar as well. If you can do that kind of on the run up to a migraine, or you can do it like through the progression or over the course of days, or you do it just like on a daily basis, it's amazing the pieces that you can start to put together. You might also want to take the migraine disability assessment. This is also known as a MIDAS questionnaire that gives you a grade as to how seriously you're affected every 3 months. Usually it's a good idea to do it every 3 months. It's also really great if you have these kind of records to track how efficient certain interventions are. So this is obviously one way of starting your process. The next thing is recognizing what potentially some of the triggers could be for you. Now, according to a review based on like 25 publications, which is usually a pretty good size review article, the top 10 migraine triggers are stress, auditory triggers, fatigue, fasting, hormonal triggers, sleep changes, weather changes, visual triggers, olfactory triggers, and alcohol. Dietary factors are less common, but their role in precipitating a migraine episode is, of course, of interest. Obviously, there's lots of room here to look for ways to improve migraines, since so many of these triggers could be worked with or recognized as part of a larger context. So we're going to look at several of these triggers in this way, while we're looking at different methods that potentially are triggering migraines. So here are here's the overview. There's kind of 4 main categories. I think I would put them in 4 main categories. One is structural migraines. So things that are like after an accident or after an injury, so post-traumatic. Something that's structural, so where you have a neck issue or a back issue. It can be farther away from your head than you realize what's triggering the migraine. And then third, if you have them coming under the facial bones and the sinus cavities. The dietary category can involve things like potential food sensitivities, inflammation in the guts, microbiome problems. We've definitely seen migraines with microbiome problems. You can also have hormonally induced migraines, and lots of different hormones can be related. It can be like the reproductive hormones, like we've already mentioned. It can also be adrenal hormones, thyroid hormones, and the hormones of glucose metabolism. And then there's also toxicity-related headaches. So things where there's environmental toxins or liver overload. This is really where I would usually put alcohol or caffeine or drugs of abuse. If those are triggers for you, we would put it in that category as toxicity related. And of course, the potential for pain medication overuse causing rebound would be in that category as well. But we're going to start at the beginning of this with structural subtypes. So structural migraines are often linked to compression of the trigeminal nerve branches in the musculature of the head and neck and upper back. And remember how I just talked about this nerve playing a key role, and also the things that supply that nerve, like the vasculature that supplies that nerve, which is close by. It has a group of connections deep in the brainstem. And it's kind of a little pale here, but in the lower left, you're seeing the 3 branches of the trigeminal nerve and their connections deeper into the yellow brainstem there. So it pops out just kind of above your zygomatic arch there, just tucked underneath it. The zygomatic arch is your cheekbone, and so there's branches coming out from underneath there and then spraying out into the forehead, down your nose, in and behind your eye, and into your jaw. So there's lots of ways of interacting with the trigeminal nerve. One of the ways that people are most familiar with nowadays is the effect of using Botox on these branches of the trigeminal nerve, because these muscles that are in the face and the head can actually spasm against these nerves. And in some patients, the migraines are significantly helped by decreasing the tension in those muscles. So basically what Botox does is it paralyzes the muscles so it can't trap the nerve and create more pain feedback. You can also see poor posture contributing to migraines. Here I've just stuck an example of the like the muscles in a violin player. So often you get thoracic outlet syndrome related to migraine. So this is a set of muscles deep in the sides of the neck. And of course, with the violin, you kind of have an interesting head position to play that instrument. And it's not uncommon to see symptoms right down the arm and shoulder with migraines involving this. So that's a pretty posturally challenging profession. It's not the only one, of course. But you can often see migraines in these people related to this positioning. And I also had said, that we can also see that dural bridge. So here's an illustration on the upper left of the dural bridge. So that's a fascial connection between the muscles around C1 and C2. So those are the highest two cervical vertebrae, just tucked underneath your skull. They're directly attached to the dura of the brain. This was actually discovered in 1995, but most doctors have never heard about that. And if you pull on the dura, you can create migraine symptoms accompanied by light sensitivity. So sometimes people can just have enough of a tension headache that it starts to actually turn into more of a migraine look to it. So when you're assessing a structural migraine, the source of the muscle activation really needs to be identified. So you're going to treat muscle triggers to effectively reduce the intensity of a migraine if you can find where they are. So you can use range of motion testing to figure out which muscles it is. And you might even be able to find muscles that are activators, not just in the muscles of the head and neck, like I was saying, but your body is really one continuous structure. It's not uncommon to find triggered muscles in the leg having an effect on the head. So when you're being evaluated, don't just assume it's in the head and neck only, and have your entire body assessed. Especially when we go in for massage for migraines, I've noticed that the tendency is everybody just wants their neck and head massaged in between migraines. Obviously, a lot of the time you can't stand it in a migraine. But really, you're going to want to look down the whole set of potential muscles. So chiro, practic care, massage, and acupuncture, they're all really useful techniques for treating structural migraines. All of those techniques actually have an impact on the autonomic regulation of muscle. And so what you do is you interact with the autonomic nerves and that can really loosen tight muscles. It can increase blood circulation. And then if you can figure out what structure it is connected to the migraine pain, you can look at posture correction. You can look at physical therapy or physiotherapy to just address that connection of all those supportive muscle structures and just improve and correct the posture and eliminate the pain. It's really not unusual for people with migraines to have heads that really hang off the front of their necks. And that seems funny to say, but positioning is everything. In the weight of the head, you're balancing this huge weight on the top of a spinal column. And if it's in the wrong place, you can put a lot of strain up in C1, C2. You often see a strong structural component in people that have really good strength, but terrible flexibility. You can also see an over-exaggerated flexibility where people don't have strength. So stretching and strengthening can't be underestimated in this type. Workstation designs, assessment of the exercise plan and what you're doing for exercise. If you have migraines, somebody should take a look over that, because sometimes you're inadvertently doing something that's actually making it worse over time. Now, the next type that's related to structural is the post-traumatic subtype. So a post-traumatic headache is really defined as a headache that's developing within about 7 days of an injury or after regaining consciousness if you've lost it in a concussion. And as a migraine subtype, this definition obviously overlaps. The impact of a motor vehicle accident or a slip and fall, or if you've had a sports injury, all those multitudinous ways we injure ourselves can be the basis of the onset of a migraine condition. And just like with the other more subtle structural issues, it can really be the basis for the onset or worsening of migraine. And because post-traumatic migraines are associated with an injury, it's really important to identify and understand the nature of the injury for treatment. This is a bit of a challenge because following trauma, at least a quarter of people with mild traumatic brain injury never seek medical attention. But that's a mistake. If you get a rapid treatment and are attended to for pain and inflammation quickly, it can really reduce the impact of that on your life. And you don't even realize sometimes that that's what it's done. I can give you an example. I was in a car accident once many, many moons ago. It was Christmas time. I'm on the highway in southern Saskatchewan. And, the road was super busy. The road had black ice on it. And what was amazing was that, it was really bumper to bumper traffic. And for some reason, as we were driving my husband's brand new truck, it had 4-wheel drive, but for some reason I had switched off the 4-wheel drive. I still to this day have no idea why. And literally we slid off and kind of rolled over in motion around a curve. It was brilliant that we were on a curve because we didn't hit anybody. So slid off and then went kind of up and over and landed back on the wheels in the ditch in a big snowdrift. And the windshield and everything held the roof on, so the roof was smushed down a ways, but we could still drive. And it didn't wreck the engine or anything because we literally went into a snowbank. But what was interesting is I really felt the activation of a lot of the musculature that I had seen in my patients who were coming to me for neural therapy, which we'll talk about in a moment as a possible treatment option. I could literally feel like some of those same combinations of contractions, which I had felt in all of these other people, start to happen when I was sitting there in the car. And, thank goodness I had that knowledge because I basically just knew what all the trigger points were and I just worked on them and kind of loosened it all up. I got back in the car and kept driving because I figured I would never drive again if I didn't. And luckily, it never turned into anything. But wow, I was just really taken aback by how quickly that was induced and how closely I had observed those same combos in others. So migraine can really occur due to a bunch of things in an accident. You can actually displace structures within the skull. Like you basically can whack the brain on the inside of your skull. That is often an injury. You can have inflammation contributing. You can get that inside your head or outside your head or in your neck. You can create decreased blood flows or metabolic changes with a concussion especially. You get this increased muscle tension in your head or neck. All of those thin layers of tissue that are like on the brain, the meninges, can be also inflamed or irritated and not moving very well. And you can get increased pressure within your skull. So a lot of the time you're going to get a common trigger of this head discomfort at that time, but you might not realize how related it is until later on because it doesn't always manifest immediately. Now, the other thing that you can do is irritate the trigeminal nerve in its relationship to other tissues in the head. For one, dental issues, including abscesses. Sometimes there'll be an tiny abscess at the root of a tooth, creating a sinus irritation and a trigeminal nerve irritation that's feeding back to the brain and creating headaches. It can come from TMJ. It can come from grinding your teeth. It can come from completely separate from the dentist dental issue, sinus problems. So if you have just chronic sinusitis, or allergies to environmental components translating into your sinuses, or viral infections like shingles can certainly activate this. So it's not uncommon for any one of those things to start or worsen a migraine condition. And depending on the specific cause, A dentist or, doing allergy testing, having an allergist can help you determine whether or not this is playing a role for you. And like I said, I was going to mention here neural therapy. Now, neural therapy is actually related, can be used on all the different kinds of headaches, but it is particularly marked when we use it for structurally oriented headaches. So neural therapy is a surface injection technique. If you've never heard me talk about it, it's a technique that's not new. It's been around for about 100 years, and it's really great for chronic pain, and it's brilliant for migraine. It will decrease the severity and the incidence of the migraine. Ideally, we treat somebody in the middle of a migraine where they can tell me precisely where the pain is. And this is, again, another problem, because sometimes this is why I'm writing down, please, if you have migraines, make notes about where they are, because it stuns me. Most people who have migraines, they spend so much time trying not to think about the migraine, or like be a little bit out of body or be medicated, that they actually don't have the full experience of their migraine. They don't want to be in their body experiencing it. So they don't know where it usually is. They can give you kind of like this vague idea, but that's about it. So let's go and take a look at some other versions of this. There's a number of different hormonal issues, like I was saying earlier, that can contribute to migraine headaches. The first and most obvious is those in reproductive hormones involved. So migraines are related to both estrogen drops and estrogen increases. So it's really important to take a look at your entire hormone picture, because it's not as easy as, oh, it's only this, and it's only when it's elevated, or it's only when it's low. You have to basically look at all of the hormonal issues together. So we actually do have that big questionnaire. Some of you might have already seen this when we talked about hormones at various times. It'll just help you identify what kind of hormonal issues might be contributing. We can also easily use testing to evaluate, and sometimes, especially if we don't want to guess, that's the best way of doing it. You can also see prostaglandins playing a role in these kinds of headaches. Prostaglandins are hormone-like substances. They're involved in inflammation and the contraction and relaxation of the smooth muscles of the uterus, but also of the intestine and the blood vessels. So if you contract and relax, this kind of smooth muscle is dependent on what prostaglandins are present. So if you're a woman with cramps, you'll produce 5 times more inflammatory prostaglandins than a woman who doesn't, and as a consequence, be more likely to suffer the migraine. So the amount of magnesium present can also increase the subtype. So if you hyperdose on calcium to magnesium ratios are abnormal in 45% of women during menstruation, and only 15% in the rest of the month. So if you're a bit of a calcium eater but not a magnesium eater, that can pose a problem, because you're actually inverting how you should have them in your body at certain times. And I personally think that many people who take calcium hyperdose on it. And so often I take people off of that. Magnesium is more important, honestly. You can get plenty of calcium in your diet. Magnesium is a little bit more challenging. Now, if we are looking at hormone balance, again, like noting if there is a relationship to the menstrual cycle, if you're a female, extremely important. Interestingly, if you are a man taking hormones to become a woman, the presence of those hormones actually increases the rate of migraine incidence to exactly the rate for women from the male level. So this is one of the reasons why we know a lot of it is it's just literally reproductive hormones, because we've actually had guys that have transitioned that way, and they show us beautifully that they just appear with those hormones being put in. I also wanted to just note that you can get magnesium from foods like spinach and chard, like all the dark leafy greens. If you eat those, you're going to get like most of your daily need just by actually eating those on a daily basis. But other good sources are things like sweet potatoes or sunflower seeds or sesame. So there's lots of different ways of skinning this cat. You can see I've put a bunch of them here. Bananas have magnesium in them. Doesn't always have to be the pill, right? Now, imbalances in the thyroid are also linked to migraines because a slow metabolism is often related to a chronic muscle problem. So of all the thyroid conditions, hypothyroid or low thyroid is most frequently associated with migraine complications. So those symptoms will include cold, feeling chilly, dry skin, irregular cycles, weight gain, slow heart rate, constipation. There's also going to be often muscular pain and fatigue. And part of that is just because your basal metabolic rate is falling. And so your capacity to actually repair things and have enough energy in that spot for normal function is lowered. You can actually strain the thyroid by a rapid move towards a vegetarian diet. Sometimes you'll see with people with thyroid issues, there'll be cravings for caffeine or alcohol, like wine especially, keeps the energy up. You'll see it'll work for 20 minutes and then kind of crash you back down. Other thyroid conditions like Hashimoto's, hypothyroidism, and hyperthyroidism can cause migraine as well. You're right, Robin. I did forget chocolate has magnesium in it. Sorry. Can't forget that. Although we're going to talk about chocolate in a sec. It's a bit of a conundrum, that one. So the prevalence of lifetime migraine is significantly higher in subclinical hypothyroidism if you compare them to controls. So by subclinical hypothyroidism, I literally mean that kind of hypothyroidism where it's not clear on the labs that how low the thyroid actually is. So you can see migraine both with and without aura significantly higher in that kind of hypothyroidism. And that's really crucial because that means that that person doesn't even know they have a thyroid problem, or they don't fit into the category of like what the standard is for putting Synthroid or some other kind of replacement in. So interestingly, there's comorbidities for autoimmune diseases observed in subclinical hypothyroidism patients that have migraine versus those that don't have migraine. So it implies that there's also other actions in the immune system that are contributing to migraine. You can also create thyroid problems with certain drugs, like beta blockers that have been used for blood pressure or heart issues will decrease the conversion of thyroid hormones. Your SSRIs, so the basic ones, Prozac, Paxil, can actually cause fluorine to replace the iodine in thyroid hormone, and lithium also can block the conversion of T4 to T3. Anti-cholesterol drugs can cause hypothyroidism. Corticosteroids are also believed to block T4 to T3 conversion. And of course, you can have less thyroid hormone production if you're iodine deficient. So there's a number of different impacts here. So ideally, you would do thyroid hormone screening first, but like I said, it could also be subclinical and you just have the symptoms, but not necessarily the full-on lab results. So if you can recognize that combination of symptoms, you want to rule that out as contributing to migraine. So you can also check up by doing a basal body temperature test. So a person should run like at 37 degrees centigrade or 98.6 Fahrenheit. And you can use a basal body thermometer when you wake up. And if you don't move around too much and you do it at the same time in the morning, you can map this out. And if the temperature is low, then and your thyroid hormone tests are normal, it could just mean you have subclinical hypothyroid. But like I said, in these studies, it's showing it can be there even if you can't find it by regular lab testing. We can also do ART testing in the office to see if there's some sort of subclinical thyroid issue. And for, longer term, you might need something that's a bit stronger than that, something that's actually going to be hormone replacement. You can also see migraine and hyperthyroidism. That's when there's overproduction of thyroxine. And so you literally need to learn how to treat an overactive thyroid. I normally do that herbally. Clinically, if it's marked, it's done by radioactive iodine ablation. You might want to go back. I don't know if all of you have been here for this, but there was also a thyroid webinar where we discussed lots more details of managing thyroid hormones. So if you feel like this relates to you and you have migraines, it's worth going back and taking a look at that. Now, the next kind of hormones are adrenal hormones. So the adrenals are these tiny glands that sit on top of your kidneys. They're a part of the endocrine system, and they regulate stress and metabolism, aspects of metabolism, and a variety of other functions. And hopefully, again, you'll remember this from our adaptogens and stress webinar that was not too long ago. But the hormones produced by the adrenal are controlling energy and inflammation and electrolyte balance. They're coordinating with all the other hormonal pathways in your body, including the ones in the brainstem and in the thyroid, and they're regulating your sleep-wake cycles. So if you have a lot of stress, it often translates into poor energy, poor inflammatory control, electrolyte mismanagement, so hydration problems or blood pressure problems. And many migraines will have a stress component, and all of these effects can make a headache worse by imbalancing those conditions body-wide. So what's interesting is that migraines often follow a period of stress. One study was actually done, showed that as perceived stress decreased, the occurrence of a migraine shot up. And I just wrote down like this quote from this study. It just basically said, this study demonstrates a striking association between reduction in perceived stress and the occurrence of migraine headaches. Results were strongest during the first 6 hours, where the decline in stress was associated with a nearly 5-fold increased risk of migraine onset. The hormone cortisol, which rises during times of stress and reduces pain, may contribute to the triggering of the headache during periods of relaxation. So if you know you're a person who gets their migraines from stress, what you're going to want to do is actually try to treat that during the actual stress itself and not after. So you can use things like adaptogen adrenal support that will typically help this kind of migraine if they're taken consistently. The other end of that is improving the sleep-wake cycle. For an example, it's been shown that melatonin can help prevent migraine if you're using it consistently over time at your bedtime. And it's probably just the effect related to stress patterns. So the therapeutic dose has to usually be about 3 to 10 milligrams per day, or per night, I should say, really. But you can start to see improvements in overall migraine. Now, it's not going to usually be the only factor, but if it's something that you recognize, if you learn the skill sets that we can teach you in the clinic, something like heart math or different meditative techniques, using things that improve your capacity to think without getting too stressed out, like the listening program. There's a number of different ways that you can skin that cat, basically. Now, another set of hormones that are going to contribute are those that are regulating blood sugar. And glucotoxicity is a state where the blood sugar levels are remaining high for prolonged periods. It's a period where high blood sugar is starting to damage beta cells of the pancreas. So what you're going to see in this like a pre-diabetic state, you're going to see kind of like an increased risk of insulin resistance. You're going to see symptoms of metabolic syndrome, which are things like hypertension, insulin resistance, changes in blood lipids, a pro-inflammatory state, a pro-clotting state, like a pro-thrombotic state, an increased waist circumference, or already an elevation in weight. There's also often systemic inflammation, neurodegeneration. So there's an increased risk of Alzheimer's at these time frames. And obviously, of course, more frequent headaches. So insulin resistance is strongly associated with both episodes of and chronic migraine. So insulin resistance is when your cells are stopping responding properly to insulin. And in fact, if you have a lot of insulin going because you're getting insulin resistant, the highest quartile of insulin secretion is associated with a almost 6-fold higher risk of migraine. But if your blood sugars also stay consistently too low, frequent headaches also can occur, especially if they're in the late afternoon or late morning, or sometimes even overnight. People will notice that they'll have these periodic headaches. And the two conditions can coexist, but it's really unclear what that relationship is between those two processes. So, of course, we already talked about that peptide in the nervous system, the calcitonin gene-related peptide. That plays a major role in causing the pain of migraines. And these are the same peptides that are found in the pancreas. And this is where the beta cells are. And in fact, these particular peptides influence the release of insulin from beta cells. So you start to see these circles of things related to each other, not just one thing, but like multiple things nested that are all have this impact on migraine. So if you have migraines related to glucotoxicity, you're going to have to find some ways of repairing the balance of blood glucose. Usually I would manage this with metabolic typing, so figuring out what do we do to actually get the metabolism to normalize on its own with just food mostly. And that can be very successful. I've had people decrease diabetic medications and find that a lot of the side effects of those issues are really reduced if they do a good job. Now, of course, migraines can also be triggered by dietary factors. Some of you might know I'm trained as an anthroposophic physician, and that's a method of medicine that comes from the philosophy and work of Rudolf Steiner. And in anthroposophic medicine, a migraine is actually described as a digestive process in the wrong place, and that the sulfurous processes of digestion are being experienced in the head. So the remedies that are used for migraine in anthroposophic medicine aim to keep the digestive forces in the right place by strengthening that movement downwards. And so there's actually a lot of iron remedies and quartz remedies that we use homeopathically there. But the classical and most frequently cited dietary triggers, so things that people eat, are considered to be chocolate, cheese, citrus fruits, nuts, processed meats, MSG, aspartame, red wine, and coffee. And it's believed in general that if you avoid those foods, headaches are going to improve. But it's also possible that it's not necessarily a food sensitivity. It can be, but it's possible that bacterial populations are modifying certain foods that make them more of a trigger. So one example is chocolate, where bacterial action can create compounds from things in the chocolate that are active in changing pain perception and nervous system function. It's also a difficult association to prove for most people. So studies have not shown great correlations. In fact, one study revealed that migraine patients show really poor awareness of their headache triggers, and they hardly recognize a trigger unless they're asked specifically. So there was an experiment that provoked 27 migraine patients who reported that light or exercise would trigger their attacks, and they actually gave them different types of photostimulation and exercise, or a combination of both. But only 11% of them, only 3 of them, actually reported attacks following the provocation. So the beliefs about a trigger can also be misleading. There's definitely evidence that people with celiac disease can suffer migraine related to gluten intolerance. And I think people should actually be screened for this if there's any suspicion. And lots of people have pointed various kinds of foods. There's basically a couple of major like food chemical components, things like tyramine, which is present in a lot of aged cheeses and a lot of like pate and yeast and stuff. So you can find all these things that will probably be having interactions with the microbiome, and they're less about actual allergies. So it's probably a more complex interaction. So I really think it's the relationship of foods. Sometimes it's if they're well selected for us, like if we're eating foods that really don't work for us, that usually creates inflammation. But how well we digest leads to changes in that inner balance with respect to inflammation and the gut wall barrier and the capacity to detoxify. And so there's other signs often that there's other issues present when people have food triggers. So if your digestion is running poorly, your liver detox becomes less adequately supplied, and then you get deficiencies basically of needed nutrients. And those common deficiencies with migraines are some of the B vitamins, which are like B2, B6, B9, B12, C, E, magnesium, CoQ10. These are cofactors to a lot of these different detoxification reactions. And it can play a role in most of the other areas that we've discussed, obviously. Hormones, glucose management, the side effect for medications for other conditions, using too much migraine meds, all of those things. And obviously the next factor we're going to discuss as well, which is environmental toxicity. And yes, Becca, white sugar could also trigger migraine. It's likely related to a couple of things. First of all, Bacteria love white sugar. Second of all, it's a huge adrenal stressor. So if you are eating sugar, especially in response to a stress, it definitely aggravates it. It's a big push for your metabolism to eat that. People think it's easy for you to eat sugar. Well, it's easy to eat it. It's not so easy to utilize it in an efficient way. Environmental toxicity is pretty tricky to diagnose. We're constantly exposed to toxins. Some of the most common toxins are mold toxins, or toxins like fungicides, chemicals that are used as pesticides or insecticides, heavy metals like mercury and arsenic, cadmium, lead. A lot of those individually are neurotoxic, and they can really affect the level of pain, and they can modify the actions of nerves. You can also see electromagnetic fields from devices contributing to migraines in sensitive people. And the treatment really varies a lot depending on the type of environmental toxin that's responsible for your migraine. And there's reasonable ways to test for toxins and metals and mold. Mostly it's different kinds of urinary testing. And you can do things like, so if it's heavy metal toxicity, you can do a detox cleanse. We did a whole thing on detoxification, I think, last year that you can go back and take a look at. If mold is thought to be the cause of the migraine, you can get mold kits, and you can also get mold urinary tests. I have definitely had patients, a handful of patients, where their migraines were directly related to mold, and they didn't realize they had mold in the house. But when we tested them, or when the mold was removed, the headaches disappeared. And, limiting your chemicals around your home can really help you to decrease migraines. If you do suffer from that, it's best to stay away from those wildly chemically produced perfumed household products. Don't spray inside the house for pests, all of those other things. I'm always amazed. My mom's the worst case scenario for chemicals. she's a cleaner, and she likes cleaners that smell like cleaners. Which doesn't necessarily make them better cleaners, but they certainly are toxic, and they can create some real issues. So don't forget to revisit that environmental toxicity lecture that we did last year. So this is a great picture. This came up from the Gluten-Free Society, and it was a lovely little picture. And so sugar's on here for you, Becca. And so is stress and muscle pain and processed foods, dairy foods, which often are very inflammatory, especially in the high Northern Europeans, caffeine, sinus problems, alcohol, gluten, obviously, allergies, hormone disruptions. This is a nice, overall viewpoint of things that sometimes are triggering factors. And it really gives a good sense of how many things can just basically throw a rock in the bag. And eventually when the bag gets heavy enough, you can produce a migraine. So I'm hoping that this is giving you an understanding of ways to evaluate headaches if you have them. And certainly it's always worth going through this regardless of what kind of headache condition you have. And I hope if you need more help with it, that you'll let me know and contact me, or investigate some of these areas for yourself and work with your own primary care or your naturopathic doctor. Now, as a reminder, we still have 5 more lectures that have been planned. I think I have a couple more than this. So next one is actually celiac disease, and we're going to do seasonal depression, concussion rehab, autoimmune challenges, and anxiety in the coming months. So I hope you enjoy this as much as I do. I just like that so many of you show up to learn. So don't forget to go to whole-life-medicine.com to sign up. Thanks for watching. I love to connect to my patient community to inform and inspire, and I hope you'll join us again in the near future. Don't forget to check out whole-life-medicine.com for more webinars and events.